Middle range nursing theory. Our team picked Hildegard Peplau, and her theory is regarding interpersonal relation theory. Team 4, and our team consists of Mark Hill Castillo, Baljit Kaur, Ellen Jane Andres, Satwinder Kaur, and Kelsey Kate Bacolod. Introduction. This presentation will give us a good understanding of the middle range theory created by Hildegard Peplau, which is the interpersonal relation theory in nursing. And at the end of this PowerPoint presentation, you will also provide a case study that will best show how the theory has been fully applied. Our team picked Hildegard Peplau. To begin with, let me just give you some few interesting facts regarding Hildegard Peplau. She is known to be the mother of psychiatric nursing. She also promotes professional standards and regulation through credentialing. She is known to be the author of the interpersonal relation theory in nursing, and she also stressed on the nurse's ability to understand their own behavior through help others to identify perceived difficulties. Interpersonal relation theory in nursing. At this theory, Hildegard Peplau described the importance of the nurse-patient relationship as a significant therapeutic interpersonal process. At this interpersonal relation, she also stressed out the nurse's ability to understand their own behavior, to help others to identify perceived difficulties. As this is said, there are four psychobiological experiences that compel destructive or constructive patient responses. This information affects how the patient would relate or would connect or will start a good therapeutic interpersonal process. One is the need, next is frustration, third is response, and the last one is conflict. Hildegard Peplau identified four phases of nurse-patient relationship in her theory. The first phase would be the orientation. It is the initial or where the trust is built between nurse and patient. The second phase is the identification. It is where the therapeutic relationship is strengthened. Third is the exploitation phase. It is where the reassessment of or reevaluation of activities is made. Then the resolution is the last phase, where the nurse-patient relationship terminated. Hildegard Peplau also identified 6 nursing roles in nurse-patient relationship. The nurse as a stranger, the resource person, the leader, the teacher, a surrogate, and lastly, counselor.
Case scenario: Peppa Calloway, 45 years old, female, came in with complaints of body weakness, frequent urination, and feels thirsty and hungry most of the time. Patient reported that these symptoms began for about a month prior to consult, but thought that the symptoms were negligible. Mrs. Calloway is diagnosed with diabetes mellitus type 2 3 months ago and was prescribed metformin as maintenance following her admission. When the nurse calls to check if Mrs. Calloway's discharge instructions are being followed, she told the nurse that she was non-compliant of the therapeutic regimen because she was told it was not effective. The nurse proceeds in asking Mrs. Calloway to visit the facility for in-person consultation, which she readily agreed. Let's start reviewing Peppa Calloway's case utilizing the Hildegard Peplau's interpersonal theory in nursing, beginning with the orientation phase. This phase marks the beginning of the interaction of the patient and the nurse. From mere strangers, they start to configure a nurse-client relationship. This is often jump-started by way of introduction where the nurse introduces her name, position, and role to the patient. It is often at this phase that the nurse collects vital information from the patient to be utilized for assessment, referral, and developing the plan of care. Trust is integral in the nurse-patient relationship, and the establishment of which at this phase is of equal significance.
Hi, myself Baljeet Kaur. Now I'm continuing the presentation and I'm going to describe about identification phase. In this phase, therapeutic relationship becomes more strengthened, more stronger. The patient discusses all information, his feelings about his health with the healthcare provider. Then after this, the doctor will make a final diagnose according to his diagnostic evaluation as well as lab investigations. Then furthermore, the nurse re-informed the client about the disease process. After this, patient is able to understand his health condition, what's going on, his health disease process. Then the patient can decide the treatment process according to her situation, according to her health condition. So this is the identification phase where a doctor, a nurse can identify the problem and then they can further give treatment.
What happens in the exploitation phase is it utilizes professional assistance to solve the underlying problem to help the patient regain level of wellness. During this phase, the nurse should use open-ended question techniques in order to adequately understand the underlying problem the patient has. It is in this phase where health professionals help the patient choose and decide what available services applied based on his or her needs and interests.
Let's start with the resolution phase. In this phase, patient and nurse relationship is terminated and the patient become independent in taking care good of herself. In case of application, the patient shows autonomy in taking care of herself once again, full understanding of the disease process and being able to balance health and lifestyle. Nurse-patient relationship is terminated in this phase.
For our references, we use the Aligold Eminard 9th edition 2017 Nursing Theories and Their Work under ProQuest eBook Central at https ebookcentral proquest library access at seneca.ca. We also use the Peplau HE 1991 Interpersonal Relations in Nursing, a conceptual frame of the reference for psychodynamic nursing. It can be found in the ProQuest ebook central at https ebookcentralproquest.com library access.senecacollege.ca.